Welcome to Physicians Keepers. Each episode features honest conversations with physicians, sharing moments that shaped them, challenged them, or taught them something worth passing on. These stories come from every corner of a physician's life: the clinic, OR, family, finances, mental health, leadership, and personal growth. If a story can help another doctor feel seen or strengthened, it belongs here. It's about honesty, courage, and community true storytelling. If you are looking for connection or a reminder that you are not alone in navigating this profession, you are in the right place. Hello and welcome to another episode of Physicians Keepers. I'm excited to have you here today. If you are watching on YouTube or you're listening on Spotify, thank you for joining us today for yet another meaningful episode and conversation with a physician. This is what we do here. This is Physicians Keepers. We talk to physicians, we hear their story, we hear their journey, how they came to where they are, and anything that they can say that will support another physician. We're all here to experience that with them. So today I have Dr. Mariel Herbert. Thank you so much, Dr. Mariel, for coming in today, for volunteering, to just putting up your hand to say, yes, I'm going to share my story. Appreciate it.
Thank you for having me.
Yeah. So Dr. Mariel is an existential psychiatrist. She's in private practice in Northern Virginia. And she believes in integrating science-based lifestyle medicine with the art of psychotherapy to honor and to understand each person's life and values. So I can't wait to hear kind of your story and your journey. And I'm sure our viewers are also wondering, the first thing we just jump into is she just mentions she's an existential psychiatrist. What is that?
So in my mind, it's really being able to practice fully and with the depth that I want to get to know my patients. But existentialism has been around for a long time. It's
Yeah.
an old philosophy,
Yeah.
and it has its own version of psychotherapy, which covers what it means to be a human being. So sort of the shared anxieties, not the pathological anxiety or anxiety disorder anxiety, but things like trying to figure out what freedom is or autonomy, trying to create meaning in life, trying to feel connected to something
Yeah.
greater, anxiety around aging and death. I mean, so sort of just what it means to be a human being.
Yeah.
And so for me, that's intrinsic to like myself as a person and sort of sharing humanity, with my patients and my colleagues. And so I put it front and center when I open my private practice.
Oh, wow, that's awesome. Now, before the title existential psychiatrist, what were you searching for as when you're a student, as a resident, what were you searching for in medicine?
So for me, I have to go a little far back. So I've actually wanted to be a psychiatrist since I was about 10.
Oh, really? Okay.
Which is pretty young. Before
Yeah.
that, I wanted to be a veterinarian, but I changed my mind because animal suffering was for some reason harder than human
Yeah.
beings suffering. Um, so I wanted to do this in part because in my family growing up, I was very much an introverted kid. I loved reading. I had a few close friends. I was considered mature for my age. I got to hear that a lot. But that also meant that people, like peers, like other
Yeah.
kids and family members, would come to me with their problems. And they potentially overshared, which
Yeah.
is a common enough thing amongst like physicians. You'll hear a lot of
Yeah.
people who become physicians have had this growing up. You also hear a lot with other therapists, like master's level and doctoral level therapists. So it's not out of the ordinary.
Yeah.
But I really loved psychiatry because I loved that it was trying to figure out who we are as people when
Yeah.
we don't ever really know.
Yeah.
So I really loved the mix of medicine, the biology, neurology, and the parts that were more like artistic and creative. And I just really appreciated the two of them together. So in part, I guess it was inevitable based on
Yeah.
how I was raised and how I grew up and my experiences. But it also really spoke to me because it was it was challenging in a way that I knew I would never be bored.
Yeah. Yeah.
So that's
Oh,
a
wow.
little. Mhm.
That's awesome that you kind of knew that early, like what branch of medicine you wanted to go in. Because most people know they want to be doctors, but sometimes they're like, they don't have a clue. I'm just going to see where I fit into this. I know I want to help people, but you're kind of already settled in psychiatry. So, I mean, was that starting the journey or starting the process, med school residency, did everything just, flow, you know, milestone wise? Did you reach all your goals, or were there any struggles when you were in the course of, being a student, being a resident, that kind of made you question if this was right for you?
Um, so there weren't necessarily struggles. I mean, it helps. So I'm pretty much mid-career now, and at the time, psychiatry was more desirable.
Yeah,
Like where other residents wanted to maybe do it because of this whole idea about lifestyle, which is a bit of a myth, but but there were other people who wanted to go into it, but it's not as sought after as it is now. And that meant that for me, I knew I wasn't going to be an orthopedic surgeon or a dermatologist. I didn't need to be, have the highest honors in everything and be a gunner and get top board scores. So all I knew was that I needed to learn enough, study enough, do well enough, and I could go to a decent program and live my life. So that actually took a lot of weight off because medical school is really tough.
yeah,
But if you are really competing against like the other students and trying to be the best of the best according to at least what it looks like on paper,
yeah,
it's really, I mean, people can really burn out early, and it can cause problems. So that actually was a bit of a relief. And I went to a program that I ranked very high and I got great training and I felt really comfortable coming out of residency. So that part worked out. I would say some of the parts, and this is a little quieter, but some of the parts where it was a little discouraging for me was sort of seeing how medicine in practice, and I sort of mean like how we learn about the culture of medicine or healthcare. These days, everything is healthcare. Didn't match up the idealized version that I had in my head. And a lot of us come to this early or later in training. I mean, for me, it was probably pretty early. And you sort of have to grieve that a little bit, which sounds really, I don't know, it sounds like a lot, but it's not necessarily a lot. It's just you have to recognize that what we wish we could do and be as physicians isn't how it works out day to day.
yeah.
So for me in medical school, it was realizing that if I wanted to do well enough, I couldn't always speak up if I saw something that was potentially concerning
Yeah.
um, or if I wanted to speak up for another medical student who I thought wasn't being treated well, that if I did, then I could be targeted in a negative way.
Oh,
And
wow.
anyone who's been in any institution or work or school situation where there's, hierarchy and expectations, how to be like everyone else and how to keep things going the way people want, recognize that this is just the way systems work. But it's hard when you're taught to, care for your patients and practice medicine to the best of your ability. And we all have to recite the Hippocratic Oath and all that. So that's why I say it was sort of quiet because it wasn't one big issue or problem. And I generally appreciated my medical school experience and all of that, but it was more just sort of having to confront the reality
Yeah.
of healthcare.
Now, right, so you're right now you're in private practice.
Mhm.
Um, was that a leap that you made right after residency? Like you were going to go into private practice, or what was your journey into private practice? Because most of us in residency, I mean, we're not ex nowadays we realize we're not exposed that much to private practice. So then we leave and we join the system, so to
Right.
say. And sometimes some things in the system don't work right with everyone.
Mm-hmm. So no, I did not go immediately into private practice. I mean, I, like most of us, I left medical school, hundreds of thousands in residency, hundreds of thousands of dollars in debt. I had no business experience really. I enjoyed sort of learning with colleagues. So I joined a small group and worked as an employee, just a salaried employee for about 8 years, before I ended up moving back near family and deciding to give private practice a try. So I'm a little over a year into private practice, but it's been a decade since residency,
Yeah.
and I sort of took the leap because I knew that if I worked for another system or a bigger system, that some of my frustrations with not being able to take my time or really do the best I could do for my patients, I mean, all of that would come up working for a system again. And so few people are still in private practice and trying to make it work. I sort of wanted to give it a try while it was still even possible, because who knows what the future will bring.
Yeah, that is so awesome to hear.
Okay.
So you made that leap into private practice. Were you just fearless making that leap? What did you do before you did that? Did you feel confident enough? Because you just said you didn't have any business education. Did you feel like from an entrepreneurial standpoint that this was just like you're good at figuring stuff out? Because that's a lot of fear with most physicians who want to start private practice. They're like, I know I want to do something different. I don't really like the system. I want to create my own, but I have no business experience. Like, what if I go in and fail? What if I don't know how to hire and fire? Like all those type of things. How did you overcome that barrier?
So the first thing was I don't know. Do you remember Maslow's hierarchy of needs,
Hmm.
like our little pyramid? So
Yeah,
basically, I moved back near family. I had some savings. I paid off a bunch of my loans when I was working.
yeah,
I knew that I had a financial cushion, so I
yeah,
wouldn't starve, and I was closer to family than I was when I was working before. So I had family nearby. I wouldn't starve. I had a roof over my head, right? I could cover basic expenses for a while.
yeah,
And this was my savings. I could do with it what I wanted.
yeah,
And even though I don't like touching my savings, it needs to actually be useful. So I thought, well, I'll give it a try. If people don't have that, don't have family help or financial security, at least for a few years, then private practice that's a big ask these
yeah,
days.
yeah,
So one was having those basic needs met.
yeah,
So I don't have to worry day to day. If I go out and buy a meal at a restaurant, I don't have to worry that, my bank account's going to be negative for the month, right?
yeah,
So
yeah,
that's one thing. And I am still paying back loans every month, so I am still doing that. But that was the first thing. And then after that, it was just recognizing sort of, I kept telling myself, well, if other people can do this even for a little while, then you can
yeah,
probably do it too.
yeah,
Um, the one benefit to being a psychiatrist is it's a little easier for me to set up that business than someone who's more procedure heavy or who
mm,
needs a bunch of staff. I mean, I'm solo. I can handle basic admin things myself. Pay for a decent malpractice policy. That's my biggest expense. I rent an office. I have an electronic medical record system,
yeah,
have a business entity, pay for my licenses, business and medicine, and can just give it a go. So
yeah,
I think that helps a lot in areas of medicine where it's more involved. I can see how it's much harder, but I didn't need to try to get a loan. I could fund this myself. I didn't have to get a loan or a business loan or anything like that. So that's one benefit to being a psychiatrist. I would say, especially a psychiatrist who also likes to do psychotherapy,
yeah,
because even when I'm full, and I'm not full yet, it's only been a year, but even when I'm full, whatever that number per week is, it won't be be a huge high volume practice. Like if I work for a big healthcare system where I'm expected to see, 2 or 3 or more patients per hour.
Yeah.
Right now, even my med check, and I air quote it because it's always more than just a check-in, but even my med check patients, I generally see them for 60 minutes per
Yeah.
follow-up appointment.
Oh,
I
wow.
wouldn't be able to do that in a system where they need you to meet, numbers and have a certain minimum. So I'm really grateful for that.
That is awesome. Like I said, you practice. I mean, you got into that point now where you saw a system that it really you felt wasn't giving you and your patients what they needed, wasn't aligning with how you thought you should practice medicine. And you were able to go in and create your own ecosystem, so to say, as to seeing your patients. So as it is a setup right now, does it feel like you've arrived at that point of alignment where like I am truly aligned with who I am as a physician and I'm delivering the exact kind of care I want for myself to my patients?
Yes, but I also went in with that from day one. So I still do myself. I do, introductory calls with people before I see them in person. I mean, the one piece I had to come to terms with, it was that knowing that it would be just me, that I'm
Yeah.
solo, that I have no negotiating power, that I have no biller or admin. I'm in an out of network practice. I'm in a high
Mm.
cost of living area, but I'm out of network practice. So I knew it would be slower to grow, that people had to be really thoughtful or have decent out of network benefits from their
Mm.
PPO insurance plan in order to see me. So that is one barrier to care that I really had to come to terms with. But after that, I mean, every person I talk to over the phone who could potentially be a patient, I talk to them about how I work, what I can do for them, and ask them, do you think, is this worth your time, your energy, including your emotional energy, your money, to even see me for an hour and a half for an initial appointment? So I don't try to sell myself. Like I said, I have some financial cushion. I worked hard for many years and help, which I recommend most people have before they jump into trying out private practice these days. But I have that, um, and I just want to do my job the way I can do it and do it well.
Yeah.
So having that pressure off makes it a little easier, and it also lets my potential patients really have a choice. I
Yeah.
mean, they're also leaving systems that are in place in order to come see me. They're
Yeah.
saying, yes, I do want something different. I don't just want a 15-minute med check from a different provider every month, or every 3 months.
Yeah.
And so if we're both working somewhat outside of the system, then we can be more aligned from the beginning.
Yeah.
So I would say, since my very first patient who actually came in and had an appointment with me, I've been pretty much aligned with my values, and my values, at least somewhat, fit with my patient's values, which is
Yeah.
absolutely wonderful. And I hope everyone can experience this at some point.
That sounds really amazing, Dr. Mariel. And kind of getting into how you practice, because we said in your bio that you're integrating science-based lifestyle medicine with the art of psychotherapy. Um, can you just kind of, for people who are like, what does that even look like? Like trying to understand it. Can you give us a run view of what that is?
Um, so in my mind, it's sort of just being a psychiatrist the way it could be, like at its best, like so not sort of fragmented or piecemeal or rushed. So lifestyle medicine isn't, just, there is lifestyle psychiatry now, which
Yeah.
allows for more of the interpersonal and connective connection and connective pieces. But lifestyle medicine really focuses on, whole body.
Yeah.
So it allows for more preventative medicine, including secondary prevention. Like if my cholesterol is high, my physician could be knowledgeable about nutrition and, recent studies about different, diets and supplements and what evidence is there, and tell me also about resistance or strength training and things like
Yeah.
that. They could actually help me with my sleep quality and coordinate care with my other specialists, and do that earlier rather than later. So that's the lifestyle piece. The lifestyle piece is just the usual word we use for how we live, and
Yeah.
that includes our so-called health behaviors.
Yeah.
So I said lifestyle medicine because that's what the other people have called it for years before me, their textbooks and things. But in my mind, it's really just medicine, but medicine more than the 5-minute check-in. Are you taking your meds? Yes or no? Are you depressed? Yes or no?
Yeah.
That doesn't feel very great for anyone, for any of us, whether we're doctors or patients. And it also doesn't really help us make real sustainable changes in our lives, healthy ones. So that's the lifestyle piece. And then I said the art of psychotherapy, because even though there is science to psychotherapy, meaning that there's evidence base for certain types of therapy for
Yeah.
certain problems, a lot of what we learn as therapists isn't easily definable or measurable, right? So we learn about how we relate to other people, verbally and non-verbally, how we develop trust in a relationship, what a healthy therapeutic alliance or doctor-patient relationship is like, and how that is the actual key to people making progress on their
Yeah.
health, on their mental health, rather than anything else, any version of cognitive therapy you could think of, or any other technique. So that's why I call that part the art. But it really is both. It's a science and art kind of thing. And I had that as my little tagline because being part of a system, like you said, and working for a system really takes away the art. Sometimes it takes away a little bit of the science too, which is also
Yeah.
frustrating, and becomes more cookie cutter in a way where you can't meet people's needs or really work on their health as a whole person. Um, but taking away the art, at least for me, takes away a lot of where I do quality work with people. So it takes away the creativity, it takes away the doctor patient relationship. And when I say take away, I mean sometimes really devalues them. And
Yeah.
nobody, none of us, whether I go and see my own doctor or I'm the doctor in this scenario, wants to feel devalued or less than
Yeah.
human. And so for me, that's why I came up with the art and the science piece. And that's how I said I link the lifestyle medicine, which is just medicine,
Yeah.
with psychotherapy.
Well, that's amazing, like I said, because even from a psychiatry standpoint, which, kind of like you rightly said, from a system, you're not going to find in, I guess, and they may be, and I may be misquoting this, but because of the way the system is set up, you're not going to find a lot of psychiatrists who are having that time to be invested in the other lifestyle aspects of their patients. And based on the science, we know that all this, like everything as regards to lifestyle, and I talk about sleep, talk about exercise, talk about diet, those affect you from the mental standpoint, right? And so then if you're not dealing with the person as a whole, then that is, like you said, fragmented care, and the patients are not getting the best value from the visits. But it sounds pretty great the way you've set it up, where you're able to combine the other aspects of their health, from a physical standpoint, and also, kind of integrate it into their mental health and say, look, these two have to be aligned because we can't just focus on the mental aspect or the psychological aspect and not see the detriment of or how the imbalance will look like on the physical side, while at the same time, like I say, coordinating it with every other specialist that they have, which is, like I said, it's kind of how the medicine should be practiced, but
Right?
it's the way it should be. But, having that patient and seeing them as a whole, and not in pieces. So yeah, so I'm really excited for your patients in the sense that they are getting the best value of care and you are aligning to your values, you're aligning to your principles and being in that space that allows you to do that. Now, like you said for psychiatry, definitely I can see how the setup is different, right? From office, structure, administrative setup. But did you take any courses in administrative work? And I mean, how did you figure that out? Or were there people who had done this before you that you kind of looked at their model and said, hey, I see this model and it looks great, and I think I want to model my practice after them?
Well, I knew I didn't want to have a group practice, and I just wanted it to be me and do patient care. So that helped streamline a lot. Because when you try to grow and hire other psychiatrists, physicians, therapists, it gets more complicated. But for a solo physician, if you can handle the basic admin tasks, and I would say one of the benefits to not, being in network with insurance plans with my private practice is I don't have to deal with that directly. Um, that part would have been hard to do on my own. And I did talk to other people in private practice because I was considering trying to credential myself. But it was just one horror story after the other. People hiring billing companies and finding out they were committing fraud, or people finding out that it was impossible to get a higher rate. From an insurance payer for the work they've been doing, and they've been trying to get a higher rate for over 10 years, or people who said they hadn't been paid in 6 months. And I wish I was exaggerating, but I'm not exaggerating.
Yeah,
I don't know what this means for a healthcare system, but I do know that at least for psychiatry, where yes, it's an expense, but it's not like people are paying me out of pocket for surgical procedures or things like that. For psychiatry and primary care, so someone's internal medicine, general physician,
yeah,
family physician, a lot of that is for people who are in private practice, especially small practices, is going to be outside of insurance, right? Primary care has this whole direct primary care, which
yeah.
is a subscription model. Very few psychiatrists do that, where most of us do fee for service. So you pay us for the
So
time, and that's it.
yeah,
And I would say it's sort of the way we're taught about doctor-patient relationship, the boundaries and limits to that. We try to model them for our patients because people generally need help with that when they struggle with, mental and emotional health issues. So it's rare that people do a subscription model because we actually want over time our patients to be healthier and have sort of interpersonal relationships that allow for their freedom and autonomy and individuality. So we actually want them relying on us less. So I always tell my patients, like, actually, between appointments, I don't want to hear from you. I assume that if I'm hearing from you and something's urgent, that something's not going well. But that said, I do have a secure system, and I let people know that they can message me anything. So if something's on their mind and it's not an emergency, but they know they'll forget, they can make use of that system because it's saved for them. It's part of the medical record system. It's just the
yeah,
messaging there, and we can pick it up in the next appointment. But I definitely didn't want it. You can text me 24 hours a day and expect me to get back to you in half an hour or your money back like it's pizza delivery or something, because I knew that wouldn't necessarily be healthy for the way I wanted to practice. So
yeah,
I guess my short version is, you don't act, I think what holds us back as physicians is sometimes we think we need to know more than we do to get started.
yeah,
Um,
yeah, yeah.
but we don't. So it holds a lot of people back, I think.
I can definitely see that. Like I said, just there are a lot of layers, I would say, to setting it up. And then once you peel back layer one and you see like seven, you're like, oh, I don't know that I can. I don't know that I can do this. But I said we're grateful for, doctors like you who are saying, hey, taking the leap, right? Taking a leap and saying, hey, this is what I want to do. This is what's going to be beneficial for my patients. And this can actually be done, you know, and just kind of jumping back because, and that's you got into something that probably led us to our last encounter because
Mhm.
you're solo. And then like I said, I mean, because you do have emergencies in psychiatry, right? What happens when a patient needs you, like, and you being the solo practitioner, like you can't be there at that time because what had happened was we actually had met for our last meeting. And
Mhm.
right at the beginning of it, you had an emergency that you
Right.
had to leave for. What if so someone that's listening to like, I don't like I feel like private practice is gonna suck up my life where I wouldn't even have time for myself. But if I go solo, what that looks like for you, or
So
is that just a rare occurrence?
it's still pretty. Well, so I guess it's a two-part answer. So it's still pretty rare. So I worked, even as an employee, I worked for a group practice where we could get coverage from one another if we were
Yeah,
on vacation, but otherwise we covered ourselves. So pretty much since even third year of residency, because third and fourth year in psychiatry residency is when we have our own therapy patients, our own psychotherapy patients long term. So since then until now, I've always covered myself outside of a couple
yeah,
vacations. Um, Oh, I guess that's the one other thing I should have said. Before setting up a business for yourself, if you're ending employment and then starting a new business, consider taking vacation, if it's something you haven't done in a while. So I took a few months off. Anyway, but I'm used to covering myself. It mostly works out because just like any other doctor, I mean, if I tell people this up front, if it's an emergency, and I include a psychiatric emergency, so when a psychiatrist, we think of an emergency sort of, am I imminent risk to myself or other
yeah,
people, right? So a lot of time it's, self-harm, suicidal thoughts that I might act on, right? That's the
yeah,
risk. That's the biggest risk we deal with as psychiatrists. There are other things, but that's the major one people know
yeah,
about. So if that's the case, they go to the hospital. So I always talk to people about having a structured crisis plan and we talk through it, but they know that I'm not their emergency solution. I can't,
yeah.
go home with them and follow them 24/7. That would be unhealthy and unethical. We talked about that. So if people reach out to me, it's with the idea there's might be some urgency there, but I'm usually one step of the plan. And sometimes it's letting me know, and then they'll follow through with the emergency plan, or letting me know, and then they use their skills, their coping skills, and other people and regulate themselves a little bit if they can, or I reach back out to them and I can help them with that. So it's not like every single day I'm dealing with psychiatric emergency. I would say it also helps that if you're in private practice, you have longer appointments. Your patient panel is smaller,
Yeah.
right? So I'm not seeing thousands of patients, so that helps too. But for the most part, it's really not a big issue. Um, so I think sometimes we can exaggerate that,
Yeah.
but like I would never call my family doctor if I thought I was having a heart attack. I will go to the emergency room, and hope
Yeah.
they treat me well. As a woman, it might be less likely that they took my symptoms seriously, right? But so that's what I talk to my patients about too. We sort of do a risk assessment and a crisis plan.
Okay, good. Now, vacation time, how does that look like for you though?
Well, I've only been in private practice for a little over a year now, so I haven't really taken vacation. Um, I always will cover myself. So if I in the past, when I was an employee, if I went on vacation, I would go on sort of maybe one vacation a year, like a week long, something like that.
Yeah.
And I might go out of the country, then I would try to get a colleague to cover. I would say now I would reach out to some of my colleagues who are also in private
Yeah.
practice in the area and see if they would cover. I have covered for a colleague before, so
Okay.
there's reciprocity there. It really helps to build some sort of network. Um, and especially if you're solo. So I definitely
Sure.
recommend people work on that. But for the most part, I'm happy to cover. If you're in the United States, you're not abroad, you can cover for your patients generally okay.
That sounds great. But yes, you do need a vacation. It's been over a year, so I would highly advocate for your
I'm still building
vacation.
up. I'm still building up my practice.
Now, for any physician who's hearing you in any sphere and they're like wondering, like they feel like they're in the system and they can't break through and they're like, is private practice for me? Or like, can I really do this? What will you say to them?
Um, you don't have to figure it out all at once. The most important thing, I think, to give it a try is to actually figure out, like, go back to that hierarchy of needs and talk to your partner, talk to your financial advisor, look at all your accounts, your investments, your real estate, whatever you might have, and really crunch the numbers and see what your kind of cushion you would have. Or what part-time job you might need, or contract work or locums or something like that. Because once you have that figured out, you're not making any changes based on fear. Because if we ever feel like we're making changes based on fear, or
Yeah.
in the middle of flight or fight, I said flight or fight, but fight, flight, freeze, our whole nervous system response, then it's not going to be a well balanced decision when it
Yeah.
comes to logic and our emotions. So after that, though, it's really a matter of just giving it a try. And I talk to other people who are really frustrated with their slow growth right now with private practice, or think that they failed only 6 months or a year in. And to me, there's really no failure. You can keep your practice open, try to grow. You can decide, no, this is too slow. This isn't going to work for me and my
Yeah.
family. You can close your practice, but it doesn't really mean you failed.
Yeah.
Um, a failure doesn't matter in to me when it comes to private practice, because it's just something you're giving a try. It's like the restaurant industry. Most restaurants fail. I tell people that if you can break even the first year, that's a good goal.
Yeah.
For some people, they think that they can jump into private practice and that first year their earned income needs to somehow match what they were making before, which a lot of it just isn't based on reality. Um, and then the other piece would be, so not making decisions based out of fear, having a realistic idea of what you need, and then deciding if you value how you value yourself and your time.
Yeah.
Um, so a lot of private practice isn't going to be direct patient care. And that's the goal. That's where
Yeah.
you earn, most of your money for
Yeah.
direct patient care. But it's going to be behind the scenes, like building a brand. As much as I hate calling myself a brand, but building a reputation maybe would be a
Yeah.
better word for it. Being a real community member and a leader in a way that you might not have been before if you were just an employee working in a system. So you have to really value that, and value it even if it doesn't match monetary return, which
Yeah.
I think is hard for people. But so there's that piece. And then I guess my last bit would be, no matter what we do, we are not we're not our jobs. I believe what I do is even a vocation for me. It has
Yeah.
positives and negatives. A lot of people don't consider, being a physician a calling. I'd say maybe it's 50-50. I haven't done a study, but I did ask around once. I was curious. But even then, we're people too. Our patients are people, we're people. And if something doesn't work out, it's okay. It's just, when you wake up in the morning, do you dread your day for one? And can you be satisfied with the work that you're doing for
Yeah.
and with other people? And if the answer is no, then I would say, okay, well, how long can you deal? How sustainable is, that demoralization or the degree of burnout you're in, or being treated like a thing rather than a person.
Yeah.
And so for a lot of people, they'll reach that point sometime during their career, more than once. But I guess that's my third point, is just checking in with yourself regularly and seeing where you are with it, and if everything still fits with what you need and what you want in your life.
That's such amazing advice, and so appreciate your wisdom with that. And like kind of like you said, is something that we tend to forget as physicians, and we have to keep reminding ourselves is that we're more than just our job. Right. There's more to us than just that. It's just sometimes we get so entrenched in medicine and it becomes a whole big part of our identity, right? And when it doesn't work out, like you said, you start something that you think, going to private practice and it doesn't work out the way you think it should have. And then you feel like you failed. I failed as a doctor. I can't give my patients, and so it's helpful for us to know that. I mean, and it could be a failure of a private practice, it could be a failure of something else, right? But to know that there's more to you outside of medicine, you can decide if you can decide you want to go to just fully go to administration or just do something different. And that's okay too. That's pretty okay. Like I said, it's just waking up every morning and figuring out is what I'm doing aligned with my purpose is what I'm doing. Do I feel like I'm aligned or is something, am I not serving a need? And that need can even be your family. If you decide that, hey, I think I want to just hang this up and I would just stay home and stay with my family. That's okay too, as a physician. And because burnout is real, right? And as much as we love to serve our patients and we want to be there for them, but in reality is at the end of the day, they all go home to their families. They all have lives. And then we also have to make sure that we're taking care of ourselves and we also have lives outside of medicine. And you did go into burnout. And, as a psychiatrist, we have to ask you, like, we have to get into the burnout conversation with you because that's a very big thing that a lot of physicians are struggling with. Um, what's your take on that? How do we curb the rate of physician burnout? Is it kind of leaning towards kind of what you did and then just, you know, doing private practice? Because it's a system that does that, right? To a lot of physicians, like how do we how do we fight against the system? How do we structure it? How do we change it?
So there's no one answer here. I think in part we need to reject the narrative that sometimes is implicit, that it's individual physician failure and that's why people are burned out. There's something defective or wrong,
Yeah.
we're not doing enough, because that's the kind of story that keeps people stuck in unhealthy systems, including in medicine. So that's the first piece I try to remind people. It's, yes, we all have our strengths and weaknesses, of course we do, but that's not why someone is burned out. Burnout, as you said, is a systems failure, and burnout, I would say, is inevitable based on the systems in which we work. Um, which so it's going to happen. It happens more than once for all of us. I think it's something like 1 out of every 2 or 40 something percent of physicians are burned out at
Yeah.
any point in time, every
Yeah.
single day. So that doesn't make it an individual problem. And I agree with you that in order to really change burnout, to have like move the needle kind of thing, as they say, we would need a significant minority of us banding together and changing the system. That's a big ask.
Yeah.
That a
Yeah.
significant minority is going to be maybe again 40% or more of us working together, with the same idea, goal in mind, and changing the system. And I say that's a big ask, one, because it's really hard to get us to change anything as human beings, right? Like history repeats itself. There's a reason why the systems are the way they are for so long.
Yeah.
But the other piece is, back to people need to live their lives and survive. And a lot of people are going to be working for systems, that are unhealthy or even just that, far from ideal,
Yeah.
because that's what they have to do to take care of themselves and their
Yeah.
family, and not just physicians, right? But everybody's sort of in that spot. So for the individual to move past burnout, one, recognize it's not a you problem. Two, understand that it's a shared issue. But then three is going back to, like you said, with starting private practice, for example, really seeing, can I spend most of my days doing something that means something to me
Yeah.
and allows me to share myself with the world that could do good. And that could be in clinical medicine, that could be in the administrative side, that could be in public health, that could be leaving medicine entirely. It doesn't matter,
Yeah.
because we're all people and we all have to live our lives, and try to be healthy about it.
Yeah.
So I guess my bottom line on burnout is that it's not us, and sometimes we just have to work around it
Yeah.
because we don't have the numbers for massive sociocultural shift.
Shift.
That's a
Yeah.
big ask.
Well, thank you so much, Dr. Herbert. I mean, it's
Mhm.
been awesome having this conversation with you
Yeah, thanks.
and just kind of digging deep into your why and your journey. And I'm sure that someone listening to you today has gotten some pretty valuable tips, and just some insight as to, hey, you know, this is a situation and this is something I can actually either work around or figure out. If she did it, so can I. So you've been an amazing physician's keeper. Now, if someone wanted to contact you, like they had any questions to ask or they just want to pick your brains or anything, how can they reach you?
So my website, herbertpsychiatry.com, has a Google form, my email, my work phone. People can message me however they want. And I try to get back to people within a couple days. So I'm happy to always talk. I've heard from so many fascinating people over the past year building up a private practice, and so I'm happy to hear from people.
Okay, awesome. And we will be sure to include those links in the show notes. But we appreciate your presence here today. We appreciate your wisdom, and we're wishing you all the best with your journey. And we're looking forward to you telling me. I'll probably send you a message sometime mid next year, and I won't forget to say, where did you go on vacation? I'll be like, it's been a year and a half or 2 years now. By now, you should have gone on vacation. Looking forward to hear
That
that.
that's a good anti-burnout tip, I would say. Trying to figure out how to take more regular vacation. That's a good tip too.
Absolutely. And so if you're listening and you have a story to tell, that's what we do on Physicians Keepers. We'll be so glad to hear from you. You can send me a message, drremlo@gmail.com. And if anything that we shared resonated with you or with another physician, please like, share, and subscribe. We just want to make, physicians, their story get out there. Someone hears it, someone's encouraged by it, someone is strengthened by it, someone feels seen, someone feels heard. And so click that like, share, subscribe button, however that works for you. And join us again in another episode of Physicians Keepers, where we would have another amazing discussion with another physician. Thank you. Thank you for listening to Physicians Keepers. I hope today's conversation gave you something useful to carry into your life or practice. If it resonated, share it with another physician who might need it. And if you have a story that could help someone else, I'd love to hear from you. Connect with me on social media or send me an email. See you in the next episode.